Welcome to the Psychedelic Passage podcast. My name is Jimmy Nguyen. I'm joined here by my co-host, Nick Levich. Thanks for joining us this week. We're going to be talking about a topic that I hope is helpful for folks. What Nick and I realize is with the emergence of psychedelics into the mainstream, and then also this novel environment where new ways of engaging with psychedelics, new services, things are becoming more legitimate, and actual, services are offered. Businesses are creating these services. There's now models of psychedelic use. We realize there's a lot of language across the psychedelic landscape that's used that many folks probably don't even agree on the definition of some of these things. And therefore, that's probably pretty confusing for you, the psychedelic curious person, the psychedelic interested person. So today we're going to be talking about the emerging psychedelic lexicon and our attempts of not only defining what this dynamic is like in the current stage of psychedelics, but also maybe trying to lay out what some of these things mean, especially
if nothing else, just from our perspective.
Right. It's our view of it. And I guess we'll start by just having this conversation that, a lot of these components of psychedelic service are being defined right now. Like, I wouldn't say that there's a commonly agreed on standards, let alone like language that we use. And you see this in Oregon as well, Nick.
Yeah, I'll give folks an example. So traditionally, if you are advertising a service as therapy, that inherently means it's being done by a licensed mental health professional. And then you look at what's happening in Oregon, where we're, in the midst of rolling out psilocybin assisted therapy, and you don't have to be a licensed mental health professional to facilitate that. And so you can see how quickly, just in one state, things are already confusing, because talk therapy, you need to be licensed as a provider. But for psychedelic assisted therapy, you don't have to have a mental health license. And so then you start to get into like, okay, well, what's the difference between psychotherapy versus talk therapy versus psychedelic assisted therapy versus psilocybin assisted therapy? You can see how quickly this turns into kind of a mess.
Yeah, would the protocols, let's say, for ketamine assisted psychotherapy be the same for psilocybin or MDMA if you're in a clinical setting, or if you were looking for a clinical medical model, but then the service provider that you get actually isn't rooted in that background, but it's all under this umbrella of psychedelic assisted psychotherapy. And then also, like, you have to disclaim if it's massage therapy or acupuncture or other therapeutic models. And so you bring up a good point that all of this has been used interchangeably, and we are in an environment where that can be really confusing for folks to really figure out what they're actually seeking and what services are actually available to
and
them.
Services are very different. The problem is, how are we identifying them and how are they being positioned? And like, candidly, we deal with this problem with, running Psychedelic Passage, in the sense that what most people are searching for when they're looking for these types of services is psychedelic assisted therapy. Mm-hmm. But then what we actually, what our network of facilitators actually provide is, I would argue, like, not traditional therapy. Mm-hmm. But that's what people are using to search for an intentional therapeutic ceremony.
Yeah, we have to be really mindful to say, hey, we aren't mental health professionals. And even with facilitators within our network who do have mental health backgrounds, they're not serving in that capacity.
Right.
And so then it gets pretty interesting, because you would think, so okay, if it's psychedelic assisted psychotherapy, that must mean that mental health professionals are providing this. Oh, but by the way, there's no licensure track for those folks to be able to do that and provide it. And so I think this is just an example of just highlighting that the psychedelic landscape is really in flux right now. And there are the, development of these tracks and these processes, but it's important for folks to at least be aware of this thing that we're talking about as you're seeking psychedelic services, just to be really clear on what folks are offering and the services that you're looking
Yeah,
for.
I think I would sum it up like this. There is a distinct difference between how the service is being labeled and then what's actually included and who facilitates it.
Yeah.
Because almost everything is getting lumped into this label of psychedelic assisted therapy. And sometimes there's actual therapy included, sometimes there's not. Sometimes it's with a licensed mental health professional, and sometimes it's not.
Yeah.
And all of those are under the same umbrella currently.
Or somebody who has, let's say, educational background in mental health, like a
Psychology
degree, counseling degree, something like that, but they don't have their practicing license yet. Or folks who do have their practicing license. So there's a lot of different, the cool thing, and I hope that there's an umbrella of services, right? I hope that there are tracks and routes for anybody. Like if I want to go down a private use ceremonial track, I can do that. If I want to go down a more traditional talk therapy track, I can do that. If I want to go down an art therapy track, I want to be able to do that. You know what I mean? And so, but yeah, this is important, especially for folks who are using this whole umbrella term of psychedelic assisted psychotherapy, because it's very broad right now. And it's really interesting because when we look at the MAPS trials and studies with MDMA, it's the first time that a federally scheduled drug is seeking approval in the combination of therapy. And so you don't normally see that. You normally see clinical trials of just compounds being passed for legal use. And this one is interesting because it combines both the substance and the therapy associated to it. And so they're also trying to define that and the standards and things of that at the federal level and the clinical level.
As if this already wasn't confusing enough, we take a lot of consults with people who call in or like, so, and they're like, so are we doing talk therapy while I'm on mushrooms?
Right.
Mm-hmm. Like they literally think that they're doing a 6 to 8 hour therapy session while under the influence of a psychedelic, which even in the presence of a therapist, that's most likely not how that's going to unfold. Because I mean, at least from my own experience, like I can barely form sentences when I'm on medium to high doses of mushrooms. Like,
yeah, and it's so substance dependent, right? Like I for damn sure wouldn't want to do that on psilocybin, but I'm like, okay, a low dose of MDMA, that could be possible.
Right.
A low dose of ketamine, that could be possible. But then you got to think like that's clinic dependent as well, right? Like the approach and the modality and like the
right. And so we see this with ketamine clinics all the time. People say, oh, well, I did ketamine therapy. And then you find out there was no actual therapy. All it was drug administration. There was no talk therapy, no prep, no integration. And so that's also being called psychedelic assisted therapy.
Yeah. So I think we've broken down this kind of concept, this psychotherapy versus psychedelic assisted psychotherapy versus therapeutic versus other.
It's like, all therapeutic. But
yeah. And then you're kind of bringing up, the difference. Here's another one, this difference between like dosing session versus program versus ceremony and what all of that entails. So help our listeners break that down a little bit.
Well, I think dosing session is the most literal term for when you are actually consuming the psychedelic. And usually that's, going to be a half to full day session.
Depending on the substance. In this case, we're talking about psilocybin. If you're looking at ketamine, that's probably 2 or 3 hours end to end, depending again on the route.
Right.
It
And I
take.
think I think when we start to use a word like program, we're defining the full extent of the program, which might include a dosing session, but may also include other elements like prep and integration as a part of the program
Might
package.
include screening and onboarding, may go across a period of time of a couple of months, or you may do it in days and weeks.
Yeah. And then
And mhm.
when I think about ceremony, for me, it's very much indicative of this moment in time where you exit different than you entered, and there's an acknowledgement of a essentially a transitionary state, and it's often accompanied by more what I'll call like sacred community and or indigenous practices.
Mhm.
To me, when I think about ceremony, it's something that honors the sacred and honors the ritual. It's kind of like the other end of the spectrum for me from what I would call like the clinical approach.
Yeah, so it's dosing session and ceremony are likely talking about the same event, but from two very different perspectives and angles. Dosing session being, you know, very neutral and
Yeah,
very to the point, and
literal.
that's and then ceremony, yeah, denotes. Yeah, I like what you said about the sacredness, part of that. And again, that depends on the tradition of the medicine keepers, that depends on the context of your use. So that ceremony in itself can also look really different. Like we have many ceremonialists within our network, and ceremony per each person is probably different as
I mean, it's
well.
different for you and I. Like
Yeah, and
it,
likely we'll have some of the same core components: opening up a container, creating safe space, offerings of prayer and things like that. But everybody would approach that differently. And so, if you're thinking about this as a psychedelic interested person or an explorer, just know that you do have these options, and it's our attempt to arm you with the right language and tools so that you can ask the questions, so that you can know what you're getting yourself into. By no means are we saying that any of this is right or wrong. I'm very staunch in my stance that, like, you have radical freedom of choice in how you engage with psychedelics. But if you walk into a ceremonial setting thinking that it's a clinical medical, you're going to have a big dissonance in,
or vice versa, or vice
right.
versa. Like you
True.
think you're going to have this sacred experience and you walk into a fluorescently lit, white walled space with a doctor's table on it. Like that's a
Mhm.
whole different vibe than a ceremonial space. And so I view those as just like opposite ends of the same spectrum.
Yeah.
There's everything in the middle, there's
Yeah.
retreats, there's all kinds of stuff, but there is a spectrum in terms of how that dosing session is approached.
Yeah. Yeah. Let's talk about practitioners for a little bit. There's a lot of terms thrown around there.
Yeah.
Guide, facilitator, trip sitter, everybody's neighbor is a shaman now. You know what I mean? Like,
Provider,
yeah. What are your
professional,
thoughts around that?
therapist, also very confusing. Also, no set definitions on what is what. I mean, I think internally you and I have kind of agreed upon some differentiating
Hmm.
factors, but that does not mean that the average human out there knows the or understands the subtleties there. And I think that's also what makes it really hard for folks that are looking for services is you've got all these names for a provider
Hmm.
and there's very little understanding about what they mean and if any of it is actually being checked, verified, regulated, etc.
In addition to what we're talking about earlier, which is the context of the services, and then you're talking about this, like, vetting and standards and some of those things. And so yeah, so I was actually talking about this earlier today. It's really interesting. Maybe we can start with trip sitter, guide, what we think those mean, and then why you and I landed on facilitator. So I'll start with trip sitter. I think that trip sitter is a very broad term, and that is anybody who is accompanying you and looking after you in a psychedelic experience. So this opens a world of a sober friend, family or friend who's just there in the house, there are some folks who will sit with you literally, and all that they're doing is just making sure that you don't hurt yourself or you don't fall, or you can make it to the bathroom okay. There's trip sitters in more public settings and environments, music festivals, things like that. But I find that a trip sitter takes a really low involvement in your process, typically just on the ceremony or the dosing day, but likely not a person who's supporting in prep or integration or anything like that. Any other thoughts there on a trip sitter?
No, I think that's a good summation.
Mm-hmm. So that's one end of the spectrum. And then I would go on to the far end of the spectrum, which are folks who claim, I'm saying this very specifically, folks who claim to be psychedelic guides. And those would be folks who take a really, really direct hands-on approach, more of like an agenda format to your experience, whether it's the experience itself, or whether it's the structure and the how to and the what to do, of your experience. And so again, I'm not saying that this is right or wrong. I just know that guide to me denotes some like power dynamics. It just denotes some things that I think people should be thoughtful of if you're looking for
See,
a
but see,
psychedelic
here's where it
guide.
gets really confusing for me, because when I internally think about guide, I'm like, oh, that's someone who's like, okay, Nick, go through the green door on the left, which is like not how I like to be led during a session, nor how I would ever facilitate for a client. But that's like the connotation that guide has for me is like tell me what to do while it's happening. But here's where it gets really confusing for us from a like company perspective, so you can see how this plays out in practice. Is like internally we refer to our network as facilitators. And then I'll let you explain why in a second here. But I was literally having a call. We're in the midst of a whole website rebrand overhaul right now. And one of the questions that we landed on is like, do we use the term guide or facilitator? And the problem that we're having is we know what a facilitator means and why that's important. But the average journeyer is actually looking for a guide. That's what they have the mental association.
A guide
of what
to them makes more sense. Like, I'm looking for a psychedelic guide. And you look at a word like facilitator, which to us feels more accurate to the scope of work. But then they're like, what the hell is a psychedelic facilitator?
Right. And so it was interesting because I actually polled our internal team, all of our concierges that take consult calls. And I asked them how people were referring to what they were looking for. And it was 80% guide. Yeah. And so interestingly enough, we're moving towards using the word guide because that's what people are looking for. But I actually believe the service that they're providing is far more in line with facilitation. So do you want to describe facilitator?
Sure. Well, and I'll just highlight that this is exactly what we were talking about in the first part of the podcast, where that may be the commonly used term, and you're looking for a psychedelic guide. And then you got to realize that there's 50 different ways of guideship, and that may be different than what you might actually be looking for, which may be a trip sitter, or what you might be looking for is a facilitator or a clinical
or a therapist. Maybe what you're looking for is a therapist.
Exactly. Yeah. So the other thing that I want to point out as well as I talk about what a facilitator is that I acknowledge that people are looking for guidance, and that is different than guiding you through a psychedelic experience. And guidance can be things around safety and harm reduction. Guidance can be things around dosage or what frameworks may be applicable for me to navigate my own psychedelic experience. But I think the major difference for guide for me, which is probably why I'm a little averse to it anyways, is where does the power sit? Like, the power should sit with you as a journeyer. It should sit with you as the individual. And we're actually talking about journeyer versus client versus patient here in a second too. I'm talking in real time, the conundrum that we're describing.
Right.
When we talk about a guide, the power rests on them. They're the ones with the knowledge, and they're the ones who hold all the cards. And then they're kind of telling you what to do in your experience and whatnot. And look, for some folks, that's right for them. I find that with psychedelic work, there's no way that that can unfold in real time.
There's just no way that the
Yeah,
provider can know what you're going through in
exactly.
real time. There's
That's what I
no,
was,
you can
yeah.
guess,
Hmm.
you can make it,
You
you
can
can
interpret.
intuitively, you're right.
Hmm.
But there's no way they actually know 100% what it is that you're experiencing, because how you probably couldn't even vocalize what you're
Yeah.
experiencing.
Yeah. So that's why we landed on facilitator. And I think that one of the main reasons we did so is to keep that power intact to the person engaging in the psychedelic work. By facilitating, that means that we are supporting, maybe creating a structure, maybe offering some information and guidance, depending on the consent and the needs of the journey or the individual. The facilitator should be able to create a program or an offering or a service that makes sense for your needs. And so you can see immediately that this word facilitation is not as strict as guide or trip sitter, and also has this sense that we're supporters. Like facilitating and supporting to me are akin to each other. And so that, I think, helps folks to realize that there's quite a lot of ranges and skill sets and modalities and ways that people conduct these psychedelic services, and facilitation gives this broadness, I think, and then also this focus on your experience, you as the journey. Or what else would you add to defining a facilitator?
I think for me, I would sum it up that the facilitator helps facilitate a connection between you and your own inner healer.
Hmm. Hmm.
Like
And you
that's
and you in the psychedelic.
right. And like they're facilitating the connection between you and your inner healer, your highest self, and you and the medicine. But beyond that, like you're therapizing yourself. And I think that's where people get this so twisted, is like they think that because it's psychedelic assisted therapy that the therapist is therapizing. But what I see most often is that it's actually the client is therapizing
Hmm.
themselves.
Hmm.
And that's
Hmm.
where the beauty of this whole thing lies, is in the self-discovery. Because once you've experienced it or seen it or whatever firsthand, no one can take that from you. Like it's not like it's the difference between hey, there's telling myself there's nothing to fear and not believing it, and then actually having the direct experience of like, oh, there's nothing to fear.
Yeah. And it's up to you and your own agency and how you interpret and define whatever comes up in your psychedelic experience. And so that's a little of what you're talking about as well, Nick, about where does it come from? Where does the help and the healing come from? And it in our cases, we've seen many, many times it comes from the individual embarking
Yeah.
on the experience.
Before we move on to the next, I guess, segment of words, I think it's important to just acknowledge that the point of this whole discussion is that at this point, nobody should be relying on a single word or definition to select their service.
Mhm.
There are additional questions and ways to dig into, like, what's included, what does it mean, what's your approach, that to me are actually way more important than the label that's attached to it.
Mhm.
Because I think the gist of this discussion is that the labels don't mean anything right now, because we don't have agreed upon definitions.
Mhm. Agreed upon definitions, agreed upon standards. Somebody says they're certified and trained. That means something different to somebody else.
Yeah. I
And
mean,
so,
in Oregon right now, we talked about this. If you want to know in detail, you can check out the episode of Measure 109 that we recorded a couple weeks back. But you're going to be a licensed facilitator in Oregon with very little training or requirements. And so licensure also doesn't inherently mean qualified or legitimate or knowledgeable. It's it's a very funny time to be in this
Yeah.
space right
I mean,
now.
we see that in industries that are standardized.
Right.
Being a marriage and family therapist takes 3,000 clinical hours, and I for damn sure know that I have seen some MFTs that suck,
Yeah, for
and I've
sure.
seen some that are amazing as well. And so when we think about Oregon, when we're talking about a couple hundred as opposed to a couple thousand, and then they're a facilitator in Oregon's psychedelic assisted psychotherapy program, you can see how it gets mixed up real quick.
Yeah, you're talking about a high school diploma in 200 hours, and now you're doing therapy on people.
Yeah. Yeah. The last thing I'll say about facilitator, what I like is that it also takes the emphasis off of the dosing session or the ceremonial day. And so when I think about facilitator, I also think about facilitating programs, which, as we mentioned before, should include preparation, should include integration, and maybe some other things as well. So you've heard us throw this around: journeyers, uh, people who take trips, I guess, clients, patients. I think those are all interchangeable as well. And those go hand in hand with the services of which you're engaging in. And so when I think about clients, those are folks who maybe are going through more of like coaching routes or those types of aspects. I think journeyer is a little bit more of like a catch-all term that can include participating in ceremonial experiences. You may refer to yourself just as a journeyer by just engaging in psychedelics, alone. I leave patients to mental health and medical, applications of psychedelics, of which again, not a lot of that is available to mainstream society yet. What else would you add here?
I view client as anyone who pays for professional services of any kind.
Mm-hmm.
And I view patient as someone who is actually engaging in services with a clinician of some sort or some sort of like true medical care.
Mm-hmm.
And then when there's other terms like participant, which are often associated with retreats, right? You're a retreat participant. You're not a retreat client or a retreat
Yeah.
patient. You're a
Or clinical
participant,
clinical trials. I see that a lot in studies, study
right?
participants. Mm-hmm.
But interestingly enough, I had the same conversation with our team yesterday of call takers. I'm like, how are people referring to themselves? Like, do they refer to themselves as journeyer or client and it sounds like most of the time it's client because journeyer is still like unclear and not totally accepted in the folks who are starting to look for this type of service.
Yeah, the one reason I like the word journeyer is the same reason I like the word facilitator, is that it denotes a process. It denotes something that you go through over time. And I think one of the pitfalls of this psychedelic interest nowadays is that there's not enough emphasis on all the stuff that goes around the support of a dosing session or a ceremony. But you're going to run across a lot of these different terms and phrases depending on who the service provider is. And it's just important for you to know that a lot of these are used interchangeably, but it obviously depends on the context of service.
Yeah. And I think it's just important that we re-highlight the challenge that service providers face right now, which is, do we label ourselves what we actually think we are, or do we use the term that you think we are?
Mm-hmm.
And there might not be the same.
Mm-hmm. Mm-hmm. I mean, look at even the regulation in Colorado. They're defining facilitator, they're defining healing center. But what does healing center actually mean, and what modalities and skills are used, and what clinicians are there versus coaches versus private practitioners? And so we'll I think that there is a attempt, a movement to kind of define and coalesce these things, but it is wide open right now. And so when in doubt, ask. A part of our intention is to help you to know the things to ask so that you can make an informed decision on what's right for you.
Yeah. That's the main point of this whole thing for me, is just highlighting, hey, this dynamic exists.
Mm-hmm.
And you can get to the bottom of it if you ask the right questions. But please, 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 my PSA for this episode is don't rely on the label to inform the care that you think you're going to get, because it may or may not line up. And the only way to know is to verify.
Yeah, a perfect example of this is a world that I live in, which is psychedelic harm reduction. And that looks really different depending on the context. And for sake of this conversation, there's harm reduction that exists all over the world, like seatbelts in a car, headlights, tail lights, things like that, safety protocols at work, and on and on and on. And psychedelic harm reduction looks really different depending on the context. If I'm out at a music festival, psychedelic harm reduction is going to look different than whether I'm engaging with you, Nick, for a ceremonial program. And that will look really different than a clinical medical model where maybe they have to monitor you with stuff and things attached to you for, a certain time. And so even phrases like that, does the harm reduction include testing? Does it, what other safety protocols are there? And so just even know that around these phrases, it's important for you to ask questions on, okay, what does that include? What does that entail? Like, what does that mean?
What are the qualifications of the provider? What is their background? What is their training? What's their approach? How are they going to engage with me? Those are actually far more indicative of what's actually going to unfold than whether they call themselves a guide or a facilitator.
Yeah. Well said. Well said. Well, I hope that was a helpful conversation. I know that we fired off a lot of information at you, but we just felt a calling to talk about this because one of our driving intentions is, how do we empower people to make their own choices with psychedelics in their own sovereignty? And so thanks for listening to us here. And that wraps up our episode. So thank you for joining us. You can download episodes of the Psychedelic Passage podcast anywhere you find podcasts or get your podcasts: Apple Podcasts, Amazon, Spotify, iHeartRadio. If you like the show, please give us a rating and a review. And we look forward to seeing you next week.
The opinions expressed on this CannabisRadio.com program are those of the guests and hosts and do not necessarily reflect those of the staff and management of CannabisRadio.com. Any rebroadcast, republication, or retransmission of this program without proper consent is prohibited.